Loop diuretics are a class of potent diuretics used to treat edema and hypertension. They work by blocking ion reabsorption in the loop of Henle, which leads to reduced water reabsorption by the kidney. Let's learn more about loop diuretics through this visual mnemonic video. Today we find ourselves preparing for a race with some serious race car drivers. Check out that loop-shaped racetrack that they'll be racing on. You know how race circuits are always shaped like loops? Well, the loop shape of this racetrack is our symbol for loop diuretics. Get it? A loop for loop diuretics? Loop diuretics are a class of powerful diuretics that induce major fluid loss by acting at the loop of Henle in the kidneys. To reinforce this looped racetrack is even named the Henle Loop. Now that we've anchored ourselves to these drugs, let's explore the rest of our scene to learn more. Don't our race car drivers look familiar? You're right. They kinda look like Vin Diesel and Paul Walker from Fast and the Furious. You can tell because they're even wearing shirts branded with a Furious logo, which refers to their Fast and Furious franchise. By the way, the Furious here should help you remember furosemide, because furious sounds like furosemide, right? Furosemide is the first drug name you should keep in mind for the loop diuretics group. Like any race car drivers, these guys have a pretty sweet ride. It looks like his race car was sponsored by the famous energy drink company Red Taurus. You know how this drink company is always sponsoring these high-octane sports? Well, we can even see that Taurus logo printed on the car. This Taurus here coincidentally reminds me of torsemide, the second loop diuretic you'll need to know. Get it? Taurus for torsemide? It's the torsemide Taurus. Finally, turn your attention to that boombox. It wouldn't be the Fast and Furosemide franchise without some killer beats. And this boombox is playing really loud pump-up music for our racers before the race. By the way, this boombox is our symbol for bumetanide. You know, boombox for bumetanide. Bumetanide is the final loop diuretic name that we'll cover in this video. Now that we've covered all the drug names to know, let's get into the nitty-gritty of how these drugs actually work. I guess the boombox was playing a little too loud because one of the drivers got shocked and immediately dropped his pre-race snacks into the pool. Let's take a closer look at these snacks while we're at it. First, notice the salty peanuts falling into the pool. These salty peanuts should remind you of sodium, since salt is just made of sodium, right? And these bananas should make you think of potassium, since bananas have a lot of potassium. Finally, the pool should remind you of chloride. It's worth noting that everything here, the salty peanuts, the bananas, and the chlorinated pool, are all getting ruined here. This should help you remember that loop diuretics work by inhibiting the sodium, potassium, chloride triple transporters in the loop of Henle. For extra brownie points, recall that these triple transporters are located in the ascending limb of the loop of Henle. Ultimately, blocking these transporters reduces the reabsorption of all three ions, sodium, potassium, and chloride, and instead traps them inside the urinary filtrate. Recall from physiology that ion reabsorption here is normally responsible for creating a superconcentrated medulla, which is crucial for the later absorption of water. Blocking this triple transporter thereby ruins the medullary concentration gradient, which in turn impairs the ability of the kidney to reabsorb water from urine. Less water reabsorption means that we pee a lot more fluid out, in what was formerly called diuresis. Still with me? Great. Let's move on. Although this is lower yield, it's worth noting here that loop diuretics also inhibit the reabsorption of calcium and magnesium in the loop of Henle. You see, the reabsorption of calcium and magnesium is actually dependent on voltage differences created by the triple transporter. Since loop diuretics block the triple transporter, they also block calcium and magnesium reabsorption. Again, this is low yield, so don't spend much time here. On another note, loop diuretics can also increase renal prostaglandin production. These prostaglandins dilate the afferent arteriole, increasing blood flow to the nephron. This increased blood flow leads to more urinary fluid loss, increasing the diuretic effect of loop diuretics. This mechanism can be inhibited by NSAIDs, which reduce the effectiveness of loop diuretics. But seriously, I don't want you to get lost in the weeds here. All of these mechanistic details are way less important than the triple transporter we covered earlier. If you just remember the triple transporter, you should be able to get almost every question right on test day. Now that we understand how loop diuretics work, let's talk about some of their clinical uses. For that, turn your attention back to Vin Diesel and his car. Even a movie star must have his haters, because it looks like someone's thrown rotten eggs all over his car. We'll get back to the rotten later, but for now, notice how our guy is cleaning up his car by dumping a big bucket of water over it. By the way, this dumping of water should help you remember diuresis, the biggest clinical use of loop diuretics. Since diuresis is just fancy medical speak for dumping water through the urine. As we learned, loop diuretics induce diuresis by destroying the medullary concentration gradient and impairing water reabsorption. Losing all the fluid via the urine obviously decreases blood volume. Because of this, loop diuretics are frequently prescribed to treat fluid overload states, like heart failure or cirrhosis. Next, take a look at that deflating tire of the car. I guess our hater must have also cut the tires here to cause them to lose pressure. By the way, the deflating or loss of pressure from the tire should make you think of reducing blood pressure, another major clinical use of loop diuretics. You see, loop diuretics can also be used to treat hypertension or high blood pressure. As we've learned, these drugs decrease blood volume, leading to an overall reduction in blood pressure. It's worth noting that loop diuretics are not first-line agents, as they have not been demonstrated to reduce mortality in patients with hypertension. Instead, loop diuretics are mainly prescribed to hypertensive patients who also have symptoms of fluid overload, such as pulmonary edema. So it's really the diuresis that we want, not the reduced blood pressure. You feel? Now that we've covered all the main uses of loop diuretics, let's talk about some adverse effects. Remember how the boombox is playing music too loudly? Well, one of our movie stars here is trying to cover his ears to block out the sound. By the way, the covered ears are our symbol for ototoxicity, the first adverse effect of loop diuretics. Because something that's ototoxic is toxic to the ears, right? The mechanism here is beyond the scope of your exam, but ototoxicity is a relatively unique side effect, making it high yield for test day. Patients will typically come into the office complaining of reduced hearing and ringing in the ears. When this happens, you should review their medication list to see if they're taking a loop diuretic. Next, let's get back to the rotten eggs on the car here. Yep, every star has his haters, and haters love throwing rotten eggs, right? These rotten, sulfurous eggs should remind you of the sulfa group in loop diuretics, since rotten eggs just reek of sulfur, right? You see, loop diuretics contain sulfonamide groups, also found in other sulfa drugs, like the sulfa antibiotics. Therefore, patients who are allergic to sulfa drugs may also experience allergies to loop diuretics as well. Next, remember how Vin Diesel dumped water all over his car to clean up the stinky eggs? Well, that bucket of water is now nearly empty, with just a few droplets of water left. This empty bucket should help you remember hypovolemia, one of the side effects of loop diuretics. It should be obvious how high doses of any diuretic can lead to excess fluid loss and hypovolemia. The only reason why we are specifically covering this is because loop diuretics are extremely potent. These drugs induce more water loss than all other diuretics, irrespective of dosage. As a result, loop diuretics are far more likely to cause hypovolemia and hypotension, which can lead to several adverse consequences. For one, low blood volume can reduce perfusion of the kidneys, causing acute kidney injury. Also, recall that hypovolemia and hypotension cause a compensatory increase in aldosterone levels. This aldosterone then acts on the kidneys to increase hydrogen ion excretion. Ultimately, this leads to metabolic alkalosis, induced by fluid loss, classically called contraction alkalosis. This is really more of a step 2 or even step 3 kind of thing, but I think the underlying concepts are actually really easy to understand, as long as you know your physiology. Finally, recall the bananas that fell into the pool. Since the bananas represent potassium, fallen bananas should help you remember decreased levels of potassium or hypokalemia. Loop diuretics increase potassium excretion into the urine, leading to hypokalemia. Again, this wouldn't normally deserve a separate discussion, but loop diuretics are among the most likely drugs to cause hypokalemia. This fact is notoriously high yield on exams, so it's very important to remember that loop diuretics can cause hypokalemia. One last side effect to keep in mind here. Note that loop diuretics can also lead to increased uric acid reabsorption in the kidneys, causing hyperuricemia and gout. While hyperuricemia is more often seen with thiazide diuretics, I honestly would have wanted to include it in this scene as well. Maybe in the next version of this video. Keep an eye out, will ya? Alright, that's it for loop diuretics. Let's summarize. Loop diuretics are powerful diuretics that include furosemide, bumetanide, and torsemide. These drugs work by inhibiting the sodium-potassium chloride triple transporter in the ascending limb of the loop of Henle. This decreases the medullary concentration gradient, preventing water reabsorption. The net effect of loop diuretics is increased excretion of water, sodium, and potassium. Because of their potent diuretic effects, loop diuretics are often used in the treatment of volume overload states as well as in the treatment of hypertension. Important side effects to note include ototoxicity, sulfa allergy, as well as severe hypotension and hypovolemia, which may result in contraction alkalosis and even acute kidney injury. Because these drugs increase potassium excretion, loop diuretics are notorious for causing hypokalemia. Lastly, like most other diuretics, loop diuretics can increase uric acid levels to increase the risk of gout. Okay, now we're actually done. Let's go grab some seats by the racetrack. I don't want to miss filming the next Fast and Furosemide video. I'll see you in the next one.